Dr. Judith Aponte. I'm from Hunter College School of Nursing, so my profession is in nursing. We're located in New York City. And today I'm going to talk to you about community health workers, which otherwise are known as peer educators in some places. First, I have to disclose and acknowledge that this study was funded by a Clinical Translational Science Award through Weill Cornell Medical College, which was NIH funded. Just to give you some background, type 2 diabetes is the 7th leading cause of death in the United States and the 4th in New York City. Type 2 diabetes is the 5th leading cause of death among Hispanics. In New York City, Hispanics represent the 3rd largest ethnic group, indicating that they're greatly affected by diabetes. To give you some background on where this study was conducted, it was conducted in the South Bronx, which is known to be the epicenter of diabetes. The South Bronx is an urban neighborhood in the Bronx, one of 5 boroughs in New York City. Diabetes rates in New York City are 9.2%, but in the South Bronx, it's 13.7%, which shows the high rates occurring in the South Bronx. The study site was at a Health and Hospital Corporation hospital, which is a public hospital, and it's called Lincoln Medical and Mental Health Center. It's a safety net hospital where at least, if not more than 90% of the patient population are uninsured or publicly insured. We did recruitment at a clinic within the hospital, and it was an adult primary care clinic. It services an average of 1,094 adults with diabetes each month. 60% of the patient population is Hispanic. 45% have a normal A1C, which is less than 7%. 25% have 25% have an A1C between 7 and 7.9%. 13 have it between 8 and 8.9%, and 18% have it 9, if not greater. So this gives you an idea of the urgency of the patient population at the study site. The purpose of the study was to analyze and evaluate the health effectiveness of community health workers by comparing pre- and post-intervention. We were looking at different physiological measures, A1C, blood pressure, triglycerides, and weight, among Hispanics with diabetes who had diabetes uncontrolled, and comparing it to those from 2 different control groups. We had a usual care control group, and we had an attention control group. First, let me explain who community health workers are, because that was really the intervention of the study. Community health workers are lay members of communities who work either for pay or as volunteers. They usually share ethnicity, language, socioeconomic status, and life experiences within the community they work in and that they serve. Community health workers have been successful in promoting health education to Hispanic communities. You'll see a lot of the usage of promotoras is another term used because they've been used among the Mexican population in Texas and across the border areas. The community health workers were recruited from a program that provided a certificate to them, so they were trained. The aim of the study was to reduce health disparities by improving the health of Hispanics with type 2 diabetes through a health behavioral intervention in a clinic setting. In total, there were 3 groups. The total patient population for the study were 180 participants. It was a randomized controlled trial. Each participant was randomly chosen into one of the 3 groups. Each group had 60 participants. The control group received usual care, completed a diabetes knowledge questionnaire either in English or Spanish, had their A1C, blood pressure, and lipid levels collected, every 3 months up until 15 months. The second group, which was the attention control group, also comprised of 60 patients, received usual care, but received the educational material via regular mail. And the intervention group received the community health worker through weekly educational classes for a total of 6 months. After that, they received 2 home visits per month for 2 months. And after that, they received weekly phone calls for a total of 2 months. The methods. They were randomized into one of the 3 groups. The inclusion criteria was they had to be Hispanic adults with type 2 diabetes, 40 to 74 years of age, either English or Spanish speaking, didn't matter because the community health workers were bilingual, and so were the team members. Receiving care at the clinic with an A1C greater than or equal to 8%, indicating that they had uncontrolled diabetes. And they had to be a patient from the clinic, so one of the ways we guided that was that they had to have had an A1C within the last 6 months. The exclusion criteria were that they had diabetes under control, so they had an A1C of less than 7, they were excluded. Were participating in another study. If they were pregnant, they were excluded. Any cognitive dysfunction, taking any medications that elevated their glucose level, so if they were on steroids, they were excluded, or had any planned surgeries during the study period. So the measurements that we looked at were A1C, blood pressure, triglyceride, and weight. The whole intervention was 10 months long. We, as I mentioned, implemented a questionnaire, diabetes questionnaire, pre and post test. Here are some study findings. So you will see that participants were ethnically diverse among all Hispanic subgroups. 33.3% were Puerto Rican, 28.3% were Dominican, 16.7% were Mexican, 6.7% were from Ecuador, and 3.4% were from other, whether from Guatemala or Salvador. And again, this is the total percentage of all 3 groups. You'll see the breakdown here by group. The mean age was 59.62 years with a range of 42 to 77 years. The mean years living with diabetes was 15.71 years with a range of 2 to 40 years. You will see that there's an equal amount or an equal number of those who preferred Spanish in all 3 groups, so they were primarily Spanish dominant. When examining gender, most patients were female. When looking at A1C, during the intervention period, which were months 3 and 6, the intervention group showed greater statistically significant improvements in A1Cs relative to baseline as compared to the other 2 control groups. During the follow-up period, month 3 and 6 post-intervention or during follow-up, the intervention group and attention control group showed further decreases in A1C levels relative to baseline. The rate of change was significantly greater in the intervention group as compared to the control group. And as we know, with these studies, I always point out and remind everyone, because the A1C is an average of a person's 3-month period, an A1C during month 3 reflects for the intervention group a level prior to the intervention. So keep that in mind when looking at these numbers. For the intervention group, month 6 reflects the first effects of the community health worker intervention. The findings of the intervention group show statistically significant benefits of the community health workers as an intervention, since the intervention group showed the largest A1C reduction between month 3 and 6 of 0.34%. compared to the attention group who showed 0.16% reduction and the control group of 0.01% reduction. The findings demonstrated that post the community health worker intervention, the A1C continued to go down, showing a positive health effect. Even going a little bit further, all three major studies, the DCCT, EDIC, UKPDS studies, have shown that a 1% A1C reduction is associated with a 37% decrease in the risk of microvascular complications and a 21% reduction in diabetes-related mortalities. So for those reasons, I wanted to look at how many people had a 1% or more reduction in A1C. And you'll see that in this study from the intervention month 3, the beginning of the intervention, up until month 6, at the end of the intervention group had the largest number of people with a 1% or more A1C reduction when compared to the other two control groups. By the end of the study, the largest group with a 1% or more A1C reduction was among the intervention group, with a 56.6%, indicating that these patients had a decrease in risk for microvascular and macrovascular complications. When looking at blood pressure, systolic blood pressure, although the trends of all secondary measures, meaning systolic, and I'll show you the diastolic blood pressures, triglycerides, weights, and diabetes knowledge were not statistically significant, the primary outcome, which was A1C, showed to be the most improved. Here are the numbers for the diastolic blood pressure. The intervention group showed the largest reduction in diastolic over the period of the study. Again, although they were not statistically significant. When looking at triglyceride, the intervention group was the only group showing reductions in levels during the intervention period. And when looking at weight, the intervention group showed significant weight gains during the follow-up period as compared to the other two groups, which was a very interesting finding, to see that their A1Cs went down, but their weights went up. When looking at the pre and post test of the diabetes knowledge, all groups showed statistically significant changes in diabetes knowledge, and the intervention group had the highest knowledge increase compared to the other two groups. The overall findings show that an increase in A1C reduction makes the community health worker intervention a noteworthy success because A1C can delay diabetes progression and diabetes-related complications. Next steps is to develop a culturally, linguistically tailored, cost-effective diabetes self-management intervention tailored to Hispanics within an urban setting such as New York City. Here are my references, and thank you.
Thank you very much. Any questions on this communication?
There's one back there.
So, yes, yeah.
Thank you. I know in your exclusion criteria they should not be on medication, I know this. But in the practice, is this so patients or participants you find so faithful, or they really break this kind of thing in following the study?
Well, my patient population in the study did take oral diabetic medications, and they were on insulin. So I took both. Either they were on orals, insulin, or on both. They were included. The only exclusion where those are on other medications that increase their blood glucose levels, because it would then deviate. It would be a confounder.
Right. So the treatment, was it stable during this 9-month period? I mean, the glucose lowering therapy.
Well, there was no therapy in itself. It was the community health worker providing educational classes in person in their preferred language. May it have been in English or in Spanish.
But they were treated with the...
So they all received usual care by the provider.
Yeah. And my question was whether there were changes in therapy by the providers.
That I didn't follow.
Yeah.
Because they were blinded. The physicians were blinded in terms of which patient population was in the study.
Thank you for your nice presentation. I have a question regarding the finding that you just mentioned at the end, where A1C is going down, however, weight is going up. Is this the first time finding, or is there any plans in the future to study there, or because this is very interesting.
It is very interesting. My plan is to, because of the real issue with community health workers is that many of them are primarily either volunteers or funded through grants. So that health policy piece hasn't happened yet to integrate them as providers or healthcare members of the team because of reimbursement. So to do a follow-up on this would mean getting funding to hire a community health worker and then figure that out. But you're right, it was very interesting to see how they went to opposite ends, and it would be more interesting to do a longitudinal where they would be followed longer than for the 12 months. Well, not only lack of education, just sustainability in terms of the maintenance of reminding them and that support system. Because they would meet, we would have group sessions. It wasn't one-on-one individual classes. So it would be groups of 5 to 6 people. And it was almost like a support system where they were able to speak to other people with similar issues. And so when that ends, it then changes how things occur.
Is there any changes in the medication that increased the amount during the study, or just kept it the same from the beginning? Because
well, I didn't study. I didn't include changes in medications because the providers were blinded into the study. So I would have had to have gone into the chart, and I didn't include that in the study.
Yeah, I think that because the weight is going up, there is a chance that the medication has been increased and the hemoglobin A1C dropped down a bit.
Good point. Thank you.
Okay, thank you very much. Here is your certificate.
Thank you.